This is Asian Insider, and I'm Nirmal Ghosh. Now, on February 27th, Iran's health ministry spokesman said that out of a total of 245 positive cases of infection with the COVID-19 coronavirus, 26 had died. That means Iran has the highest reported number of deaths from the coronavirus outside China, raising questions about how the government is handling this public health crisis and whether it has been fully transparent. Today, I'm joined by Dr. Sarah Parkinson, Assistant Professor of Political Science and International Studies at Johns Hopkins University here in DC. Dr. Parkinson's research examines organizational behavior and social change in the context of war and disaster, focusing on the Middle East and North Africa. And Dr. Orkideh Behruzan from the Department of Anthropology and Sociology at SOAS at the University of London, who is currently in Boston, I believe. Dr. Behruzan is an author and anthropologist of medicine, science, and technology. Thank you both very much for sparing time for us this evening.
Thanks
Thanks for having us.
Thank you. Dr. Behruzan, perhaps I can start with asking you, I know it's a very broad question, but what is going on in Iran? Iran has not been as well covered as other countries like, of course, China is one thing, but then we have a lot of news out of South Korea, where there's also been a big outbreak and so forth, but not much understanding of Iran. Could you enlighten us a bit on that?
Good evening. The question of what's going on in Iran is as you mentioned, a very big question. What we do know is that certain statistics are coming out, but I also want to emphasize that we have to take statistics with a very critical look, and we cannot take numbers at face value because a lot of contradictory reports are coming out of Iran at the moment. One of the things that's happening is that we do know that there was delay in diagnosis, as in many other places, and also there was delay in action. Unfortunately, the early cases were not, the information about the early cases were not spread and shared in a timely manner. And we also do know that despite diagnosis, despite confirmation of diagnosis, certain measures were not taken, and experts calls for example, limiting movement in and around the city of Qom, or stopping flights to and from China were ignored. So this is what we do know, and we also know that there are certain at the moment, given the visibility and the mode of transmission of the virus, and also the speed with which the virus is spreading, it's become a challenge to in a way manage information. So there is the main defining factor in this epidemics right now in Iran is the way in which it's been politicized, and the securitization of information has been a major issue. We don't know which parts of this information have been suppressed and which parts have come out in a timely manner. We do know that certain people who have been talking about the virus early on have been pressured or warned. We also do know that medical staff are under immense pressure inside Iran, and they're doing the best they can, but the situation is very complicated, in part due to sanctions. And I can talk a little bit more about the impact of sanctions on the situation later. But what is important is the way that, because the epidemic has become extremely politicized, it's very hard to know which part of this information that you just shared is more reliable than other parts. There is speculation that the numbers that are coming out are only the tip of the iceberg, but again, that's countered by other narratives that you see from different sources that are saying. So the main way the information is being, public awareness is being raised is in two ways. It's either one extreme of everything is okay, this is just like a flu, and the other extreme is creating a lot of fear and talking about the fatalities. And as you mentioned, the fatality rate is high, but we have to also remember that fatality rates are high because they also depend on diagnosis. So only severe cases have been, and not all of them, but only severe cases have been tested. So it is it is expected that a larger number of people are infected but have had mild or moderate manifestations. And therefore, if you take them into account, the fatality rates change. So this is another way in which we have to be careful about how figures and statistics, how data is collected and how data is distributed. It's very easy to talk about mortality rates without having number of diagnosed cases. It's very hard to talk about it. So all of these numbers are still in the making. One of the things we do know is that the severe cases in clinically, the manifestations have been likened to what doctors have seen in H1N1, but it's also spreading at a rate similar to pandemic flu. So those two facts pose very severe challenges to clinical decisions and the way doctors are handling this. Some reports are coming out of Iran from the hospitals, from clinicians, and it's been mentioned, again, all of these are personal accounts and individual accounts. And, I'd like to emphasize that different kinds of information are coming out, but a lot of them are talking about the fact that they're not at liberty to discuss details. And that says something, that tells us a lot about how information policed in this instance. And this is one of the reasons why it's important to look at epidemics not just in terms of the biological aspects and the virus and whatnot, but also in terms of the socio-political and the historical context of epidemics. Epidemics are by definition both medical and socio-political and historical entities, and their manifestation depends on that socio-historical context. Even their biological manifestation can change. And so in the case of Iran, we also are looking at a very severe case of, if you will, mismanagement of not just the epidemic, but also public anxiety in relation to it. And that's extremely dangerous because this is why context again matters. In the past few months, Iran has seen extremely difficult days, and Iranians in general have gone through a roller coaster of really tragic events, including the crackdown protests in November, and then the tragedy of the downing of the passenger plane, the Ukrainian airline plane, and then in the context of the protests, also the shutdown of the internet. In all of those instances, besides the tragedy of the event, there was cover-ups, and there was a sense in which that people are being lied to. And that context is important because it means that right now, whatever information is coming out, even with delay, right now, there is some information coming out from the establishment, some, information awareness is being spread through the media, but trust is extremely damaged and at a very low point. And so this also creates a lot of anxiety that's unwarranted, and a lot of misinformation is being circulated. And this is why I urge people to look at what clinicians are saying. My colleagues in Iran are actually spreading information that is more reliable than the media, and especially than domestic and Persian-speaking media.
Okay, Dr. Parkinson, perhaps I can bring you in on this. What are the implications of this outbreak in Iran for not just Iran, for the wider region? You've tweeted about the risk to states in the Levant, states like Lebanon, Palestine, Syria, and of course Israel. And there's been talk of it getting into Africa, of course, as well. What is your take on that?
Well, in terms of the larger region, one of or two things to sort of remember is that this is an extraordinarily interconnected region, both because of trade, but also because of travel for schooling, for pilgrimage, and even for specialty healthcare, as medical anthropologists like Max Skelton have pointed out. It's also an international transit hub when it comes to Gulf Airlines, for example. So what you have is a lot of movement, and that's not even to get into forced migration. There is currently a crisis in Idlib with Syrian refugees, where 1 million people are basically fleeing Idlib. So in this particular setting where there is interconnectedness, There's also an issue with the condition of health systems. Now, I want to emphasize that there's immense skill and knowledge of medical providers in these systems, but one of the issues is that many of them are currently weak because of ongoing or recent conflicts. For example, the Syrian medical system has been severely affected by conflict, as have parts of the Iraqi system. Mosul University was, of course, a hub of medical knowledge in Iraq, and that's a university that's still undergoing recovery right now. In Lebanon, it's worth noting that they've experienced at this point 134 days of protests, that there is a massive financial crisis, and that even in a context where there's immense medical skill, there have been shortages, and there's serious concern that the medical system is not prepared to take a major crisis at this juncture. Layering onto all of that, in individual countries, there are differing levels of trust in the government. In Lebanon, again, for example, trust in government, parliament, and civil society, according to Arab Barometer, is extraordinarily low and has fallen since the Arab uprisings. Most people believe that corruption is endemic. Only about 20% of Lebanese say that they trust the government, parliament, or judiciary. Now, importantly, trust in private institutions is higher, and most of the medical system is private. But in this case, that means that about 43% of people report having either some or great trust in private hospitals. Very few, and it's important to also emphasize that there are very few coronavirus patients right now in Lebanon. It's either 2 or 3, depending on which reports you go by. They're in Rafik University Hospital. But again, to pick up on this point that epidemics are both medical and social events, they're also political events. So one of the things to think about here is that in settings where there is immense inequality, where there are huge debates over the future of refugee populations, what we're seeing now even is the scapegoating or extraordinarily unnecessary sort of painting of refugees as threats, which is not at all the case here. I like to emphasize that bad healthcare management or bad healthcare governance is a threat, that bad crisis management is a threat, and that, that coronavirus really doesn't care about nationality, but you do see people taking this opportunity to sort of forward particular political narratives about refugees. We saw yesterday in one Lebanese municipality, all Syrian refugees being placed under a mandatory 2-week quarantine when no Syrian cases have been identified. In Lebanon, the 2 cases arrived on a plane from Iran. So that's just sort of one view of how the greater political context can interact with a health event like an epidemic to create the conditions of discrimination and repression.
Okay, I think it was also you who had mentioned an interesting aspect, and we're almost out of time, but I want to squeeze in a couple more questions. You had mentioned an interesting aspect that it's not just doctors and epidemiologists who should have input in these crises. You need medical anthropologists, who were essential during the Ebola epidemic, perhaps because they could help develop appropriate interventions. Perhaps you could elaborate a little bit on that?
Sure, and I think this, gets to Dr. Behruzan's point as well. One of the things to remember is that diseases don't occur in a laboratory environment; they occur in the context of broader society. So, people like medical anthropologists, people who study healthcare systems in public health schools, political scientists who study the politics of healthcare, for example, in the United States, which is obviously, a hot button issue in our current electoral cycle. All of these people can sort of inform broader analyses and understandings of this epidemic and what the unexpected issues might be. So one of the examples from West Africa during the Ebola crisis, for example, was that several states would be considered, post-conflict settings. And the idea of holding up a thermometer that in many cases actually looks like a pistol. The thermometers that I've seen are, it's like a white pistol-shaped thing with an actual trigger. So the idea of holding that to someone's head when they've experienced a war feels very, very threatening in a way that someone in another context might not experience that. To give a different setting, some of the work that I've done in Lebanon on the politics of healthcare access for refugees has been sort of focused on what is the actual experience of seeking medical care. So one measure of access to healthcare might be, is there a hospital within an hour drive or a 4-hour drive? In a place like Beirut, there are multiple exceptional hospitals that are very close by in the city. But the question is, if you're someone who is undocumented, if you are someone who Syrian intelligence is seeking, if you are someone who is documented but doesn't have enough money to pay for private care, how are you going to seek care? And you start to see all of the barriers that might be thrown up in what is seemingly a place with, exceptional healthcare access. And you can sort of see people working through, if I go to this hospital versus this hospital, how much will it cost? How many checkpoints are between me and the hospital? What are the risks to anyone who goes with me? And that's how we start to see this sort of broader socio-political context of disease, and can think through, well, if we have thousands of people who are afraid to seek healthcare, it's a very different story than a system in which people feel very confident accessing the healthcare system.
Right. Dr. Behrouzan, a quick last question to you very briefly. It's interesting that the United States is also scrambling, and many experts say it is unprepared for a crisis of this magnitude. A more unprepared, it has also hit South Korea and Iran, not to speak of China, but we are seeing how a democracy, where at some point restrictions may well rub up against human rights, but is way more transparent, how such a political system and culture deals with this crisis compared with China. And you have these other variations with their unique histories and cultures. So perhaps a last quick word from you on that, on the cultural context, Dr. Behrouzan?
So the key question that's being asked in relation to Iran is that, why action was not taken when it should have been taken, when the cases were diagnosed, why information was suppressed, why it took longer than it should have, and also when we knew that we have the epidemic on our hands, why the city of Qom was not, dealt with in a way, like, for example, the shrines are still open and people are doing communal prayers, and flights continued to and from China, and so on and so forth. But to understand that, we need to understand the context of policymaking and these decisions, because it's very, the main thing is why experts are asking for something and the establishment is not responding to that. Now, this is why it's important, as a clinician, I can relate to the calls that the experts are making for these measures to be put into place. But also as an anthropologist, I can see how complex it is to just, this is not something you can reduce to, well, experts are asking something and a religious establishment is refusing to do that. Because it's not the first time that in Iran we're dealing with the cover-up of information. A very important historical precedent is the HIV/AIDS epidemic that came to Iran. Was confirmed. The first case was confirmed in 1986. But after that, you had a decade of denial on the part of the establishment. When you look at Corona, the cover-up is in a way different because it's a political cover-up. The reason, in part, why the infection wasn't discussed publicly was that there was an election coming up. There were concerns about the public participation and turnout. The strategic significance of the city of Qom is also important. Qom is a city with a very, very high turnover of pilgrims, both from different areas of Iran, but also from abroad. 2.5 million pilgrims a year from abroad visit Qom. And so the clash between these interests prevented the experts to be able to implement the measures they wanted to implement. One of the important things in all of this is that both inside Iran and outside Iran, the coverage of the story has become extremely politicized. And I want to actually emphasize the importance of critically reading these reportages, because inside Iran, the politicization has to do with the events I mentioned, but also has to do with, extremes of whether this is nothing or this is the end of the world. And so it leaves very little room for accurate information to be circulated. And outside Iran, it's been discussed by others that the coronavirus has been as intertwined with narratives, narratives of colonialism and racism. And in the case of Iran, it's also important to understand that it's being intertwined with the narrative of posing Iran as a threat, and so there is that danger of numbers. As I said, more fatality rates are being circulated without. We don't know the fatality rates because we don't know the exact number of cases.
The exact number.
That being said, this is a very important, extremely worrying moment in which even the medical professionals themselves are being admitted to the ICU. Many are recovering, but many are not. We also know of at least one nurse who unfortunately and sadly lost her life. So it's a moment that the anxiety that's associated with the disease is not fabricated; it's real, as is the virus itself, and it poses a massive challenge to the establishment, both in terms of managing the virus and managing the public anxiety around it.
Thank you very much, Dr. Beruzan. Dr. Parkinson, thank you very much again for sparing your time for us this evening on this very critical subject. It's a fascinating conversation. Thank you. So as we've heard, the outbreak in Iran took everyone by surprise, coming out of the blue, and represents a very great danger, not only for Iran, but for the rest of the region, where we are dealing with a very varied region with varied kinds of regimes and governments, and a lot of refugees in conflict and post-conflict areas. Now, a few hours ago, Saudi Arabia announced that it was suspending visas for pilgrims, and that is considered by experts to be a sensible thing to do. For Asian Insider, I'm Nirmal Ghosh.